Everyone, my name is Lindsay Evans. This is my presentation on the environmental health objective for the Healthy People 2020 initiative for HSCI 3200. So, what is the goal overall for environmental health? The overall goal for the environmental health objective is to promote health for all by creating and supporting a healthy environment. So, what is the environment and environmental health? The World Health Organization defines the environment as all of the physical, chemical, and biological factors external to a person and the behaviors associated with those factors. Environmental health is the specific field that helps to decrease the chances of illness or injury that a person may face due to their environment. Environmental health is important in public health because a healthy and stable environment is crucial to increasing and maintaining the quality and quantity of life. 23% of all deaths globally occur because of a preventable environmental factor. So there's 6 focuses that the Healthy People 2020 initiative kind of breaks down the environmental health objective into. These themes include global health, communities and homes, toxic and hazardous waste, infrastructures, air quality, and water quality. And I'm going to be going a little bit in depth on each of these because all of the objectives within the main objective are broken down into these categories. So there's only one objective that falls under the global health category, and it's a pretty big goal. It's reduce the global burden of disease due to poor water quality, sanitation, and insufficient hygiene. Healthy People 2020 hope to see a 10% improvement in rates of deaths caused by these global health issues. The last time they did this study, there was almost 2 million people dying because of these health inequities, and Healthy People 2020 hope to see a 200,000 person reduction by 2020. Communities and homes. This theme is pretty dense. There's a lot of little objectives kind of divided into these main objectives, but I condensed it. The objectives from this category include reducing indoor allergen levels, specifically allergens caused by pests like roaches and mice, increasing the proportions of schools that engage in healthy and safe environmental health practices like getting rid of mold, not using widespread pesticides for vector control, especially in regards to like bugs, rats, stuff like that, and inspecting water sources for lead and bacteria. Increasing the amount of people living in a home that doesn't have lead-based paint and reducing the amount of homes in general that have lead-based paint in them. And then also reducing the amount of occupied homes that have moderate to severe physical damage. So toxic and hazardous waste. The 2020 objectives meant to reduce harm caused by toxic and hazardous wastes include reducing blood lead levels in children, particularly in children under the age of 5, reducing pesticide exposures that results in a trip to the hospital, reducing the amount of toxic pollutants released into the environment, and increasing the amount of municipal waste that goes to recycling instead of the landfill. This is the infrastructure category. Objectives under this category include reducing exposure to chemicals like arsenic, cadmium, lead, mercury, chlordane, and DDT, increasing the number of states and territories that monitor disease that can be caused by exposure to environmental hazards like pesticide poisoning, lead poisoning, mercury poisoning, acute chemical poisoning, and carbon monoxide poisoning. And then improving quality, utility, awareness, and use of existing environmental health information systems to monitor environmental health-related disease and conditions. In 2010, there were 23 of the states and territories in the United States were using a integrated information system that tracked these environmental health concerns. And the goal is to be fully in with all 50 states and territories. So air quality, this is one of the most important categories in the initiative. Objectives in this area include reducing the number of days the air quality index passes 100. I'm sure we're all familiar. We had a couple of days that were above 100 as we were in fire season, so it's very important that we reduce the amount of days that we have like that in general. Increasing alternative modes of transportation like bicycling, walking, and carpooling to reduce toxic air emissions, and then reducing toxic air emissions caused by mobile and industrial sources of toxins. And then I believe this is also one of the more important objectives. The initiatives under this theme include increasing the amount of people that have access to a community water supply that meets regulations set by the Safe Water Drinking Act, reducing waterborne disease in water intended for drinking and personal use, reducing the amount of water each person consumes in a year, to help with any droughts, and increasing the amount of days that beaches are open and safe for swimming to encourage exercise amongst the populations. So in summary, these objectives cover a broad range of concerns ranging from safe drinking water, infrastructure for exercise, lowering the levels of toxic substances in our environment that we may be subjected to, and surveillance from multiple governments to assess environmental health stressors. So this is an example of a successful study/intervention that was on the Healthy People 2020 initiatives list. I talked a lot about preventing exposure to lead, especially in children, and this study kind of focuses on that. In 2016, a group of scientists reviewed a previous study conducted in 2008 that determined the effectiveness of household interventions for preventing or reducing lead exposure to children under the age of 6. The group looked at 14 studies from around the world with about 4,500 participants, children of ages like newborn to 6, and found that at-home education prevention was not enough to reduce blood lead levels in the children tested. The group wrote that more research is needed to find a way to reduce the risk of exposure to lead, but it is bigger of an issue than any one family could tackle on their own. The study discussed that a lot of these families where their kids have been exposed to lead at some point in their life have tried to reduce or prevent exposure by dusting and cleaning their house and checking the water lead levels, but universally it appears that no matter what these families do, it doesn't really have a successful outcome as far as exposure to lead goes in their children. The takeaway is that there isn't a lot that individuals or families can do to improve their environmental health, not just as far as lead exposure, but in general. It is up to government officials and policymakers to make the difference for the people that they serve. And this is really important as a public health student. It's important that we advocate for these people that are being underserved and mistreated. Also important to shift the blame away from individuals or families and instead start holding corporations and the government accountable for people's poor environmental health. So that was my presentation on environmental health and its objectives in the 2020 Healthy People Initiative. I hope you learned something. Thank you so much for listening.